The advantage of the SLActive surface is that it's hydrophilic, which means that it has an affinity for water.
Die Oberfläche ist wasserliebend.
There's a very dramatic blood acquisition, if you will, against that implant surface. The blood just kind of runs up along that implant surface and coats it immediately.
This good wettability results from the fact that the surface is very pure. The difference with the SLA2 is that the surface is pure.
Diese Reinheit wird dadurch gewährleistet.
This purity is guaranteed because of the measures taken to keep the implants in a pure state. The implants are transferred to a saline solution in a nitrogen atmosphere immediately after manufacturing, where they are stored. And that's why it then becomes so highly active.
It's a very chemically reactive implant surface. One of the ways we look at how the implants heal in our patients is we look at how much bone forms against the side of the implant.
Cells that did attach were much more active at being bone cells.
When the implant is in place, bone cells must be deposited very readily in even the finest structures of the surface, so that the implant is securely anchored in the jaw.
We can show with the new chemically active implant surface that we're getting much more rapid bone formation and thus more stable bone around the implant.
It must be remembered that the SLA1 needed 6 to 8 weeks before it was integrated and anchored. The SLA2, by which I mean SLActive, only takes 3 weeks.
Chemical reactivity is important for speeding up the healing process against the implant surface. With the new SLActive technology, we feel like we can reduce this to probably 3 to 4 weeks of healing and therefore making it a more successful experience for our patients.
Das menschliche Leben ist kurz, also.
Life is short enough. So why should we make things complicated for ourselves with wounds that heal poorly? And that's really what SLActive is all about. Rapid healing of the tissues around the foreign body.
Des Fremdkörpers.